The internal oblique muscle is just deep to the external oblique in the abdominal muscle wall. Internal oblique originates from the inguinal ligament here in the front, the anterior and lateral iliac crest, and the thoracolumbar fascia all the way around here in the back. I have a mic pack on, so let me turn the other direction. So the thoracolumbar fascia all the way around in the back. It's going to come around, it's going to insert on ribs 9 through 12 and the linea alba. So let's talk about those attachment sites. The inguinal ligament here in the front is actually an extension of external oblique. So internal oblique attaching to the inguinal ligament blends those two muscles a little bit. Then it's going to attach to the anterior and lateral iliac crest almost all the way around the iliac crest. So you can see that it's really coming into that lower back. Then we're going to come into the thoracolumbar fascia, which attaches to the transverse processes of the entire lumbar spine, as well as the sacrum, the iliac crest, and the rib cage. So those are going to blend together, the internal oblique and the thoracolumbar fascia. As it comes around then, it's going to insert on the back of ribs 9 through 12, and it's going to come around and insert all the way down the linea alba. The linea alba is that band of connective tissue that divides the abdomen into right and left halves. So we said that at the inguinal, internal oblique is blending with external oblique. And then we realized that by attaching all the way around the iliac crest, the muscle is coming almost all the way into the lower back. So when we think of lower back pain, we need to be thinking about external oblique and releasing that muscle as much as we are anything in the lower back. Then it's going to blend with the thoracolumbar fascia, which is that fascia that sits all the way across the back of the body and really affects what's happening with the sacrum as well. So internal oblique could actually affect what's happening in the lower back and in the sacrum. So again, when we think of sacral pain or lower back pain, we want to be able to work with internal oblique. As we come up on ribs 9 through 12, that insertion, the muscle is going to interdigitate with latissimus dorsi. It's also sitting in there with external oblique. So those muscles kind of lay on top of one another. This is going to allow it to share fascia with latissimus dorsi. And so latissimus dorsi could also affect the tension in internal oblique or vice versa. And then it's going to come around, it's going to insert into the linea alba. Now, linea alba is a common attachment site for all of the abdominal muscles. Actions for internal oblique are going to be same side rotation. So if I want to contract my right side, I'm going to rotate to the right. Lateral flexion, some trunk flexion, and it's going to compress the abdominal contents.